Nothing happening. Benadryl. Good job, son. What if they say, oh yeah, I spiked a low-grade fever last time? Tylenol. Good. Pre-medicate your kids. Pre-medicate the patient. Ask them. You can stop a whole mess of this problem in the butt before it ever happens. Yes? Having a major reaction. There's your check. There's your steps. If you start to have a major reaction, here's the rule. You ready? Stop and disconnect the IV. Stop and disconnect the IV. But why, Miss Howard, why do I have to disconnect? Learn from my mistake. I had a patient having a mild reaction. I just turned it off and went to go, took a set of vitals, assessed my patient, went to go call my doctor, right? Went to call the provider. One of my buddies, who's another RN, oh, Jamie's IV is making noise. Here, let's turn it back on. That's the right look there, kid. That is exactly the right look. You stop and disconnect. Often you have to take in vitals during a blood transfusion. Sometimes they say Q 30 minutes, like every 30 minutes. Sometimes they say Q 1 hour. You follow the procedure of your facility. Did we? Yes. How did I say we're going to fix it?
Diuretics.
And?
Slow the rate.
Slow the rate. All right. An acute hemolytic reaction is the kind that likes to kill people. This is what killed my two patients. What a damn thing I could do about it. Alright? The body attacks the red blood cells. Alright? So, I'm pouring in red blood cells. My body says, breaks them apart. Hemolytic. Now I got all these pieces of red blood cells floating around in my blood. There's one organ system in my body that's really pissed off right now. Anybody want to guess what it is? My kidneys. My kidneys. That's why they get back pain. Okay? Shortness of breath, chest pain, back pain. Oh my goodness. That is a medical emergency. Mild allergic reactions. Maybe a low-grade fever. It's the acute hemolytic reaction that will kill. There's your symptoms of fluid volume overload, shortness of breath, hypoxemia, crackles, and tachypnea. Why? Because they're in left-sided heart failure, the fluid's leaking out of their bloodstream and into the lungs. Okay? Tachypnea. My heart gets all kinds of excited because I'm short of breath and it wants to move the oxygenated blood just as fast as I could. Acute hemolytic transfusion reaction. That bottom line that says sense of impending doom. When I was in school, when they would teach us that phrase, I always thought, oh, they're full of shit. No, they're not. I've seen it, folks. When a patient looks at you and goes, I'm dying, you listen. You listen, you just check it at the door, put on your roller skates and get running. All right? They will complain of back pain, headache, sense of apprehension or increased anxiety, chest pain, and sense of impending doom. It's a real thing, folks. All right? You see it with this, you also see it with PEs. Pulmonary embolisms. Rapid ready pulse because of the height. Don't give me 650, I want a gram. Well, Miss Howard, what do we do if they have any type of reaction? You stop and disconnect.